morning, so I'm gonna perform a postural drainage and percussion. So first things first, check the patient's chart, obtain any relevant information, and we must also include checking the recent patient's chest X-ray for any appropriate indication where the site the affected area is. So after that, we also have to coordinate with the nurse if the patient did just take recently a meal or when was the last time they took up a meal. So once inside, we have to sanitize our hands, introduce ourselves to the patient, explain to them the therapy that this is a clearance technique where we're gonna position you and it would help you loosen up or clear up your secretions and open up your airways and prevent your lungs from being collapsed. So with this, we also have to check the ID band for confirmatory purposes. Make sure we do our set-o assessment of the patient, obtaining vital signs such as the SpO2 and heart rate. Make sure we auscultate it to make sure that where the affected area is, where the abnormal lung sounds, we're gonna locate it with auscultation. And then we also have to ask the patient if they were experiencing any pain at all. And once everything's good, we can proceed with the patient in positioning them. So with this one, I'm gonna position the patient anteriorly, so where we target on the upper side on front. So the patient will lie flat, supine, and then we should have a pillow just in case this is a pillow that would support every time we do this. And then with this one, this patient is a female, assume. So because I target on the top, we avoid on the nipple side. So we target here on the top. So if we do this postural drainage, ideally it's done at about 3 to 5 minutes only. And then we should also have a percussor cup if we have those, but if we don't have that, we will use our bare hands by positioning it like a C shape. We should not do it in a flat. So when doing this, it should not be too forceful, but in a strong manner when cupping it. So we have to let this do like that. So while doing the percussing part in the drainage, postural drainage, we also have to inform and educate the patient that if they can do a pursed lip breathing, so that way it would help loosen up their secretions. So contraindications that we avoid is that we take note if the patient just came from surgery, the patient if they have recent pacemaker, the patient does have any wounds at all, we should also avoid the spine. And then we should also take note for any complications or adverse reactions such as the patient might lead to hypoxemic, have any pain, increase your intracranial pressure, vomiting or aspiration. So if there will be any adverse reactions present, we should immediately terminate the therapy, reposition the patient, and try to stabilize the patient. So assuming everything's been doing well, once we're done with this, we have to reposition the patient at upright, and then we have a basin or specimen cup where the patient will expectorate, so that way we're able to obtain any specimen. So after that, we have to take note the post-assessment by obtaining vital signs such as the SpO2 and heart rate, and also re-auscultating if there are any improvement of their breath sounds. And then another thing is when doing this, we should ideally do it 1 hour before taking meal time, or if the patient does take up meals, 1.5 hours between 2 hours after meal time. We can also give specific recommendations to the doctor, such as if we can do it together with a nebulization treatment, so that way the nebulization would help mobilize or loosen the secretions upon doing the postural drainage and percussion therapy. So once everything's good, we remove the PPE such as the gloves, take note the caller's consciousness if they're doing well, and then once outside, we chart everything, what we notice to the patient, what our observation is, and then if the staff in charge or physician is present, we can coordinate and communicate with them also.